Hello friends, I am Dr. Shreya Krishna, an oral and maxillofacial surgeon. Today I will be educating you about problems of our temporomandibular joint or our jaw joints. So what is the temporomandibular joint? Our jaw joint, which is located on either side of the face, is called the temporomandibular joint or the jaw joint. Now it is responsible for the movements of our jaws for various activities that go unnoticed throughout the day. The most obvious being for talking, for eating. The others are even for swallowing, which is not noticed. Our jaw joints are in action or in motion almost throughout the day, just like our knee joints or our shoulder joints, which are responsible for movement of two parts of the bone. Similarly, jaw joints help us in moving our lower jaw for all these activities that I mentioned. Now, it is found that temporomandibular joint disorders are found in 1 in 5 people. It is this common a disorder, however, it is also extremely untreated and unnoticed by the patients themselves. This tendency to ignore leads to acute or imminent joint disorders to progress to become chronic TMJ problems. Now in this video, I would want to tell you about the various kinds of joint disorders and how you can catch symptoms of these disorders at the earliest stage possible. Now there are 5 most common signs and symptoms that your temporomandibular joints or your jaw joints need your attention and your oral and maxillofacial surgeon's attention. The first and the most obvious, pain in your TMJs. So the pain can be on one side or it can be on both the sides. If your jaw joints are paining, definitely it needs attention to find out the cause of this pain. Secondly, sounds from the joint. Now sounds can vary from a simple clicking when you're opening or closing the mouth or a grating. Thirdly, if you're unable to open your mouth entirely and you can feel a change in how much you are able to open the mouth, it again needs attention. Fourth, if your jaw gets dislocated, which means when you're doing some activities like yawning, your jaw opens and gets locked into the open position. This is also called jaw dislocation and definitely warrants attention. Fifth, headaches. So very often you must be running from pillar to post, meeting all doctors and neurologists to find out why you're having a headache and why you're not able to catch the root cause of it. Many a times we see disorders of the jaw joints or our TMJs are the reason that we are getting these headaches. And lastly, shoulder or cervical neck pains are very closely associated with disorders of our joints. So let me today categorize these disorders of the joint into 4 broad categories and explain the treatments for each. The first kind of jaw joint disorder that we see is a problem of the disc called disc derangement of our TMJs. Now how will you know that you have a disc derangement and you need to visit an oral and maxillofacial surgeon? So the most commonly is first, pain of the joint, and second, clicking sounds. If you have either of these, you must book your appointment with your oral surgeon and visit them. So when you do come to us to find out whether you have a disc derangement, what we do is a physical examination. We put our fingers in front of your ears, we make you do some opening and closing activities, and we often advise MRIs of the jaw joints to find whether your disc is actually deranged, which means is your disc correctly positioned between the bones or has it moved in the front. If you do turn out to have this sort of disc derangement problem, there are a couple of treatments we do advise depending on what stage of the disorder we catch you in. It can range from simple medications, changes in lifestyle, or washout of the joint, which we call as jaw joint or TMJ Arthrocentesis. If the arthrocentesis proves to be the answer to the problem and you're relieved of all symptoms, we stop at that. Many patients don't find any relief in their pain or clicking despite this joint lavage or arthrocentesis. In such cases, we have to do a surgery to reposition the disc into its correct position. When all fails and you have such a severe disc problem that it can be neither repositioned into place, or when you're not even able to open your mouth to the least possible, then we have to go in for what we call as total joint reconstruction of your TMJs. We do this with computer guided techniques, and we do this with custom fitted joint prosthesis, which means that the design of the joint is done exactly according to your anatomy and according to your CT scans. The second most common type of joint disorder which I'll discuss is hypermobility of the TMJs, which means conditions in which the joints or the muscles around the joints are so loose that your jaw keeps getting dislocated. We have various treatments for this as well. It starts with something as simple as bandaging your face temporarily. Second, injecting some special substances around the joint which leads to tightening of your ligaments and your muscles. And third is surgical option when nothing else works, wherein we smoothen out the edges of your bones so that the movement of the jaw is completely seamless. The third most common disorder that we see is a problem of the opposing bony surfaces of our TMJs, which can be the top portion of your lower jaw, or it can be part of the skull where your lower jaw articulates. So the most common bony disorders we see are arthritis. It can be osteoarthritis or it can be rheumatoid arthritis. To find that out, again, we do specialized x-rays which can be either MRI or CT scan. We do a physical examination, and sometimes we even ask for blood tests. The treatment for arthritic conditions of the jaw joint can be simple measures like medicines and lifestyle changes. It can be the jaw joint or arthrocentesis as discussed previously. Or third, again, it can be total joint reconstruction or TMJ reconstruction, which is again done by computer planning. The fourth most common type of jaw joint disorder which I will discuss is disorders of the muscles that envelop our jaw joints. This is again very common, especially we saw an upsurge of this kind of disorder during COVID times because the trigger we found was stress. So during stressful conditions, our muscles which surround the jaw joint, they go into a spasm, and this leads to a very painful condition and also leads to limitation of mouth opening. The exact disorder is called myofascial pain dysfunction syndrome. We have various treatment modalities to treat this. It begins with conservative measures. It progresses to lifestyle management. We might even give prosthesis or splints or covering of the teeth. And when nothing else works, we explore surgical options. As you would have understood from my video, that whatever may be the disorder, the first step is diagnosing where the problem lies, whether it's the disc, whether it's your jaw, or whether it's the muscle. Second, once the diagnosis is done, the correct treatment and in the correct manner should be done. We should not directly jump to surgery, and we should not under-treat with only medicines when you're a clear case of surgery. So choose your doctor wisely and don't ignore pain. If you found this video useful, please like, subscribe and comment, and follow our other videos so that you can find the answers to all your facial problems. Thank you.